Hi, I'm Alice and I will explain you more about the cardiorespiratory patient category. Firstly, I will summarize the different types of diseases that are included in this term, and then I will focus on a specific case and how to build up a rehabilitation program for this patient category. As you may know already, the cardiorespiratory term is used to describe pathologies that affect the heart and the lungs. The term includes the cardiovascular disorders, CVDs, which are considered by the World Health Organization as cause number 1 of death, and diseases correlated with the respiratory system, including obstructive, restrictive, or vascular disorders. Many cardiovascular pathologies can be prevented by educating the population and decreasing risk factors such as tobacco use, unhealthy diet, obesity, physical inactivity, and harmful use of alcohol. But if prevention is not sufficient, surgery is needed. Every type of cardiac disorder has a specific surgical procedure, and it's important for you as physiotherapists to know the method used by the surgeon in order to determine risk factors such as increased length of stay, decreased physical capacity, and increased rate of complications, and to build up a tailored program for the patient. Stroke and heart failure are considered as emergency pathologies, therefore a rehabilitation program cannot be prescribed, while for valve replacement, coronary artery bypass graft, or aneurysm, patients are placed on a waiting list, and a preoperative training can be significant. The studies used in my research focus only on CABG and aortic aneurysm. Therefore, the rehabilitation program will be based on parameters for these two types of surgery. Research shows that physical function, post-surgery complications such as infection and pneumonia, length of stay, and quality of life were the outcome most influenced by the rehabilitation training program. So, how do we begin? Based on results and findings, the rehabilitation should last minimally 4 weeks in order to have significant improvements on post-surgery outcomes. Baseline measurement can be taken with the spirometer to assess the breathing muscles, the 6-minute walk test to check the physical fitness, and the questionnaire SF36 to analyze the quality of life. The initial intensity should be set at a moderate level, and it can be increased based on the response of the patient during the exercises. The ideal frequency is 3 times a week in order to not overload or stress the physical capacity. Moreover, breathing and aerobic exercises are the most suitable ones, especially to decrease post-operative complication rates. High-intensity training can be feasible, but evidence shows no added outcomes compared to breathing or aerobic training. As mentioned, rehabilitation is feasible, but the studies until now focus on different rehabilitation exercises, such as aerobic, resistance training, breathing, or balance exercises, rather than how to create an effective program. So the aim of this research is to find and demonstrate the most suitable rehabilitation intervention for cardiorespiratory patients, taking into consideration all the risk factors and complications that might occur pre- and post-surgery, analyzing the intensity, the duration, and the type of treatment. So let's start with the case.